Mothers bringing their children to the Jaramogi Oginga Odinga Hospital in Kisumu would spend hours waiting in the line for healthcare services before it dawned on them that the nurses they were waiting for would not be coming after all. They had gone on strike, paralyzing operations at the hospital. A state of affairs that was replicated in other public health facilities across the country as a countrywide nurses' strike began. In Migori County, patients were left to their own devices as nurses abandoned their workstations. While in Mombasa at the Coast General Hospital, patients said nurses had turned them away, a number of families seeking means to move their loved ones to private facilities.
Paka sasa sijapata huduma. Sijui kama nitapata huduma saa ngapi mpaka niende nyumbani.
Sasa hivi saa hii wanasema watu watoke na mgonjwa mwenyewe ndio huyo ako hali mbaya. Sasa hii kama wanatuandikia, yani ni kama unalazimishwa kutoka.
In Kiambu, nurses assembled near the Kiambu Level 5 hospital gate, leaving the patients unattended.
We are also advising those relatives outside there who know that they have got their patients in Kiambu County Hospital to come for their relatives and patients.
At the heart of the industrial dispute is a collective bargaining agreement that is yet to be signed and deposited in court. Hopes of reaching a speedy resolution on the matter, however, dimmed later in the day after the Salaries and Remuneration Commission declined to give a go-ahead, saying the draft document, which leaves a 40 billion shilling hole in the national coffers, had failed to adhere to the Commission's advisory on basic salary, health risk allowances, emergency car allowances, responsibility and uniform allowances. The Nurses Union also declined to attend a meeting called for later in the day, saying they would only attend a forum to sign the agreement. The negotiation of their CBA was done from January to May 2017, after the nurses went on strike in December 2016. However, the process has since stalled. SRC's rejection of the document coming just hours after the Council of Governors and the Ministry of Health indicated the document was ready and it was only a matter of time before it was signed.
Once SRC makes a pronouncement on the matter, county governments will go ahead, together with national government, will go ahead and sign a CBA with the Nurses Union.
We've agreed on all the issues that were outstanding, and we are just in the process of hopefully today signing the CBA or initializing it, and then we just register it with the SRC, and then thereafter we take it to the court for registration. So
the COG, however, also pointing out that the new terms will require an infusion of funds.
In terms of financial implication, the draft CBA proposes Kenya shillings 40 billion 366 million 442,400 over and above what was approved in the return to work formula, which is Kenya shillings 3 billion 474 million 144,000 for every financial year.
With its refusal to issue the letter, the SRC has thrown a spanner in the works. There would be no demonstrations across the city as the nurses down their tools. However, the nurses firm in their resolve not to return to work until their CBA is signed and sealed. Wilkis Anyabwa, Citizen TV in Nairobi.